Hello, everyone, and welcome to this episode of Ignition Time. Folks, the Omicron variant is spreading rapidly in the United States and could bring a punishing wave as soon as January of this year. Now, there is a silver lining to this, folks, because fortunately, this is not as serious as the original strain of COVID, but unfortunately, Omicron is more infectious. Welcome to this episode of Ignition Time, everyone. My name is Dr. Nitin Chhoda, and on this channel, I explore important matters pertaining to the country, the economy, as well as our money. Here's a headline of an article on your screen from the Washington Post. Omicron spreading rapidly in the United States and could bring a punishing wave as soon as January of this year. And this is a warning from the Center for Disease Control. Now, federal authorities and drug company officials are signaling that they do not favor revising vaccines, saying that the existing regimen plus boosters are effective. So this is good news, folks. So what's going on? Top federal health officials have warned in a briefing that the Omicron variant is rapidly spreading in the country and could peak in a massive wave of infections as soon as January of this year. Now, the prevalence of Omicron jumped sevenfold in a single week, and at such a pace, this heavily mutated variant of COVID could create pressure on our healthcare system and could actually result in more hospitalizations. Now, more and more pharmaceutical companies are saying that, hey, the existing vaccines are okay, make sure you get the booster. And based on the data so far, we believe that this is what the pharmaceutical companies are saying, that existing vaccines plus a booster shot are an effective weapon. Now, there are two scenarios for how the Omicron variant could play out throughout the country. The worst case scenario has many health officials really concerned because they are concerned about a fresh wave on top of Delta and influenza, meaning the flu, and they're concerned about what they call a triple whammy that could overwhelm our healthcare system and devastate communities, especially communities with low vaccination rates. Here's a quote from Marcus Plesher, who's the Chief Medical Officer for the Association of State and Territorial Health Officials who participated in the call with the CDC. I'm a lot more alarmed. I'm worried. And he basically said, we've got to get people ready for this. So, folks, basically the Delta variant is still making its way across the country. Then we have Omicron. And now this is peak flu season. We're actually getting into peak flu season right now. So, early data is showing that individuals who are fully vaccinated and who received a booster shot remain largely protected from severe illness and death from Omicron. But not many Americans have received the booster. Over 54 million Americans have indeed gotten the booster out of 200 million people who are fully vaccinated. So the problem is not everyone has gotten the booster. And basically, the politicians are worried, pharmaceutical companies are worried, and there is another scenario which could potentially be good. That's a smaller Omicron surge in the spring. Now, we don't know what's actually going to happen, but one federal health official said they're considering the information at the highest levels right now and thinking about how to get the public to understand what the scenarios mean. It looks daunting. The implications of a big wave in January that could swamp hospitals, we need to take that potential seriously. So, folks, I want you to let me know in the comment section below, what do you think is going to happen? Are we going to see a full-scale surge of Omicron essentially overwhelming our healthcare system, or are we going to see a milder variant that essentially goes away and something we don't have to worry about? So I want you to know that the entire strategy for the Biden administration essentially depends on vaccination, including boosters and testing. And President Biden announced his action plan on December 2nd for fighting the virus this winter. And he said it doesn't include shutdowns or lockdowns, but widespread vaccinations and boosters and testing and a lot more. So it looks like the main focus from the Biden administration is getting people vaccinated and making sure people have booster shots. Let me know whether you agree or disagree with this. The Washington Post did quote an administration official as saying, we have to be careful not to repeat mistakes of the past. If there is a change needed, we want to make it, but we don't want to end up making a change if we don't really need it. It costs time, money, and effort. So that's where things stand right now, everyone. It's really difficult to predict what's going to happen because basically, folks, it's not easy to just manufacture a new vaccine. It takes a lot of time. So if the existing vaccine can work in a safe and effective manner, if boosters can work to help combat the Omicron variant, that indeed may be the best thing to do. In fact, Dr. Anthony Fauci, who's the chief medical advisor on the COVID response team for the Biden administration, said this: there isn't any compelling reason right now to drop everything and make an Omicron-specific vaccine, as opposed to continue to administer vaccine for people who are unvaccinated and boosting people who are vaccinated. Now, also, Walensky, the CDC director, said this on NBC's Today Show. He said, while Omicron is more transmissible, I want to emphasize that we have the tools now to keep Americans safe. So folks, let me know what you think in the comment section below, because I can tell you that things are changing very quickly. Scott Becker, the chief executive of the Association of Public Health Laboratories, who was also on the call with the CDC, said, I quote, "It was really important for the public health community to understand the early signals because it's all about preparedness and readiness." So that is what's going on, everyone. Pleasure also had some other comments. The hope is that it is going to be less severe, but the concern is that the numbers could be so great, even if proportionately less people have to be hospitalized, the numbers are much higher and a lot of people are going to be really sick and overwhelm things. One interesting point Dr. Fauci did say that the United States might lift the travel bans against countries in southern Africa if the detailed analysis they are conducting now shows that the bans made no difference up until this point. I, for one, don't think the travel bans should be lifted, because all it takes is a few cases to come in and all of a sudden we have a full-fledged pandemic. I actually flew in to JFK, to John F. Kennedy Airport in New York in March 2020. I was overseas at the time and I was blown away by the fact that there was no testing. People were jam-packed into the airport in March 2020, coming in from different parts of Asia. And I believe that if we had been more stringent in our protocols back in March 2020, we could have reduced the number of people dying from COVID. That is where things stand, everyone. Let me know what you think in the comment section below about the potential new deadly wave with Omicron, and potentially the best case scenario where this just fizzles out and is not as dangerous as it could potentially end up becoming. Let me know what you think. Please click the like button. Please click subscribe. Please enable notifications. My name is Dr. Nitin Chhoda with Ignition Time. This right here is my Twitter feed. My Twitter handle is ignition_time. Thank you so much. I'm looking forward to seeing you in the next episode of Ignition Time. Take care. Bye.